With this, I now invite Ajit Ashok and Sumit Kard to take us through the disease surveillance program, which is piloted by IET. Now, I don't want to steal the thunder here. I would let them to sort of describe what they are doing. But to introduce the panelist, Ajit Ashok heads the Research Digital Group at the Philips Innovation Campus. He is involved in building competence and creating digital solutions across the spectrum of health continuum, from healthy living to home care. His major areas of interest are in healthcare regulations, AI, ML, big data and analytics, healthcare solutions for the value segment and for developing economies. He is very passionate about decentralizing and democratizing healthcare, taking care to people, making it accessible and affordable. We have the next panelist. Presenter is Dr. Sumit Kard, Associate Principal, Life Sciences South Asia for IQVIA. He's got over 15 plus years in healthcare and life science industry across consulting, sales, strategy, marketing, and digital transformation. He has led engagement with key industry executives in help transforming their business strategies to define new models of care, revenue generation, and improved care experiences. He currently leads the managing consulting practice at IQVIA India and has held leadership position at Roche and IBM before this. He serves on various industry committees on healthcare and has published thought leadership content on leading platforms on a variety of healthcare and life science topics. So without much ado, thank you so much for being with us, Sumit and Ajit. We really look forward to an interesting session.
Thank you, Ravi. Am I audible?
Can't thank you enough, Siemens, for your immense contribution to healthcare.
Actually, I forgot whatever I had to speak because after the sessions on 5G, digital twin, quantum computing, I'm actually lost. But let me gather my thoughts, right? So in this session, myself, Ajit, and Sumit, we are not representing our organizations, but we are representing IET, right? So the project that we have done is on the IET platform. So that's what we'll take you through. Now, as Ravi sir indicated in the beginning of the session, right, as the healthcare working group, the Future Tech panel, we do a lot of things on position papers, having a lot of awareness programs, startup support, etc. So we thought this year we'll also go an extra mile and do something concrete that can be touched and felt. And that's SARTHI for you, and that's what we have tried to do, right? So if you can go to the next slide. But before we actually go into the solution that we have done, I wanted to acknowledge the team that is behind this, right? Because all of us have day jobs, and this is a team that has come together to solve this problem for our nation, and that's what we want to do. So can you stand up, team? Anjali, Chakshu, Reshma, Mahesh, Dr. Vikram, Sumit, yeah? Yeah. And Shikha, who has from Siemens, who has funded this. Please stand up, Shikha. And Ujani and Gunjan from IET. We can't forget their contribution. Yeah. So one thing you will notice, right? We are blessed to have women power with us. So that's already a recipe for success. The second thing that you'll notice is, for example, Anjali is from Siemens. Chakshu, Reshma, Mahesh are from Capgemini. Dr. Vikram is from Deloitte. Dr. Sumit is from IQVIA, and I'm from Philips Healthcare. So IET is that neutral platform, right, where including competition, all of us have come together to solve this problem, and that's the beauty of this solution, right? Now let's go further, right? So Dr. Sumit, you are a medical doctor. So what is your view on disease surveillance as a subject?
Sure, Ajit. Thank you for setting the context. And let me, am I audible? No? It's not working.
So let me also warn you, right, while we spoke about 5G, we are also experimenting 4G here. So we are trying to wirelessly project from the tab through the laptop on the screen. So bear with us as well.
Audible now?
Or maybe you can. Yeah.
Sorry. We are talking about future tech, but these are few nuances that we have not been able to decipher around the corporate world, setting up mics, televisions and whatnot. Apologies for that. Yeah. So yeah, Ajit, thank you for posing that very valid question. So let me set the context by narrating a very interesting short but a very true story. On the eve of December 30th, 2020, a very fascinating thing happened. Okay, while the world was preparing for the celebrations of the New Year Eve, there was a small office in Canada of a software firm, okay? And the firm office was hustling and bustling with a very key finding that they got. Any clue about what that finding was? You might have heard a little bit about it. And that finding, if would have been embraced by the world, it would have transformed the way the world looked after 2020 or in 21, 22 and further on. Any clue? No prizes, but any clue? Sorry? Yes. So you know about corona, but you don't know what exactly that finding was. So let me give you an idea. This particular software firm, which is a SaaS-based proprietary firm in Canada, they actually flagged a cluster of unusual pneumonia. That's the term they used, unusual pneumonia cases. Some place in China, a small place called Wuhan, okay, and they were able to pinpoint the market and the areas around Wuhan around which these unusual pneumonia cases were on the rise. They did not know the term coronavirus. And this happened exactly 9 days. I repeat, exactly 9 days before WHO came into the picture, released an alert statement that yes, the world could be hit by a novel coronavirus. So imagine the power of social analytics. Okay. Why I took the example of this particular case, the company was called Blue Dot. It's still called Blue Dot. And that's the brainchild behind SARTHI. That's the inspiration that we took. And the key for the success of Blue Dot in kind of predicting the outbreak was purely on big data. And the data points that they captured, 90% of the data points that were captured were publicly available online. These were like consumer forums, speeches by public health officials, social media channels like Instagram, YouTube, Facebooks of the world. They capture data points from that. Even they got data points from the weather data points they ingested in their platform, and also the global ticketing data, okay? They were able to identify, in their list, there were 11 cities which were on top of their list where they predicted that the spread would happen. And out of those 11 cities, 9 cities were struck by COVID first across the globe, okay? Imagine if WHO or we live in a pompous world, so they did not embrace the findings of this company. And imagine if they would have done, we could have saved a number of lives, okay? And this is something that brainchild, what we plan to do with SARTHI. SARTHI, for my English folks who do not understand the term SARTHI, it's a synonym for chariot driver or charioteer, okay, someone who drives a chariot. So that is something that we want to drive the healthcare forward for our citizens, and also we want to move across the globe as well. Okay, so I will just hand over to Ajit once again, and then I will come back to give you a live demo of how the SARTHI works.
Thank you, Sumit. Hello. Yeah, so when we talk about disease surveillance, India already has a very robust disease surveillance program, right? Where data from 36 states, 670 districts is collected for 13 disease conditions already, right? So every state reports it to the central unit, and then it is published, etc., already available. So then what is that we want to do? So what we want to do is we want to take it a step further. So we want to also be able to predict it. We want to take a lot of data that is coming from also social media, consumer forums, and those places to be able to also predict it and take it forward. So that's the basis of this thing that we want to do. So time is of essence here, right? So the data that comes from the IDSP is already a week delayed, and what we want to do is to be able to take it at least when people are starting to talk about it, etc. And the real power would come when we are able to also match this along with that actual data on the ground, and then be able to predict this going forward. And that's what we will also showcase to you. So if you can, so if you can directly go to the next slide. So what we have done is we have called this as SARTHI. As Sumit said, SARTHI stands for charioteer, or who takes you along. And we want this to take us along on this journey of having health for everybody and good health and thing for all, right? So our objective is to provide that support to the government to be able to do that. And what we have done till now is we have collected a lot of data from the social media, that is Twitter, Facebook, also a lot of global forums as well. And we have been able to, we have wrote a lot of data transformation elements to be able to clean their data, remove all the false positives as much as possible, and transform the data. And also render it through an application that we'll also show you right now. No? So without much ado, let's get into the solution, and that will give you clarity on how we have progressed on this journey. Sure. Over to you, sir.
Thank you. Thank you, Ajit. So we'll go directly into the solution that we have or the platform we have. We will try to give you a live demo. I just pardon a little bit of lag here. Okay. Yeah. No, that's fine. I can manage. Okay. So pardon the resolution challenge, but I will explain. So if you see, this is the map of India. This is a heat map that we have developed. We picked up 3 important mosquito-borne, vector-borne disease, popularly known as dengue, malaria, and chikungunya. They are quite widespread across India, across all states. And you will see the spread here in different colors. The C and the D and the M stands for dengue, malaria, and chikungunya. You will see certain numbers there. So for example, we are sitting in Karnataka, so I can give you an idea that the number is around D205 somewhere in Andhra Pradesh, something around 600 odd in Karnataka. Let me reiterate. Yeah, let me reiterate that these are not the actual number of cases that we are trying to showcase you. The number that you see here are the data points that we have captured from that particular location. These data points, as I mentioned previously, we have used automatic platform to collect data points from consumer forums, public health websites, social channels, digital media channels, news channels, or the news which publishes online news across various healthcare touch points. And I also want to reiterate one important point. We captured these data points in 11 vernacular languages. Hindi and English are the most popular languages in India, spoken in India. But we also tried to capture more than that. We captured 11 languages. We used 11 languages to capture certain data points. So these are actually the mentions or the data points that we collected that kinds of highlights the concentration of a disease or outbreak of a disease in particular area. Now, in the interest of time, I will go into one particular disease, which is dengue. Okay, I will go into Delhi. My friend is doing it. So we have the list of all the states. We can pick and see which is the state that we want to pick. I picked up Delhi. If you go to the advanced filter again, Ajit, once more. The advanced filter, can you click on advanced? Yeah. So we have the capabilities to select the state, the districts within states, since India is a huge country and one state like Delhi itself is of a size of a European nation. So we would love to know where exactly the outbreak could happen or has happened. Okay, so we could select all those things. We have certain data points that we have captured on consumer forums, tweets, YouTube, etc., which I have mentioned. We use a lot of parameters like sentiment analysis as well. So if you click on apply, okay, so you see here Delhi. Okay, so you see the number is around 600. So, and the data points that we have captured here are from April 2022 to September 2022. So around 6 months of data has been captured, and there has been around 600 data points that were captured in and around Delhi, which is the capital city of India. Now, if you zoom in, the number splits. Okay, and the spreads also split. Now you see the 600 split it into 500 odd plus 80 odd in certain region in Delhi. Okay, when you click on it, it will give you the name of that region. So here it's a place called Central Secretariat or Rohini, which is in the north and west part of Delhi. So we are trying to give you a directional input in terms of where the outbreak or where the disease could have spread more. We have to correlate with topography, we have to correlate with weather, we have to correlate with hospital data as well, which we have not done here because that is something we need help from the government of India. But that's why it's in the embryonic stage. But this is the power of social analytics that can provide you. Now, it's very important. You might ask that, okay, this is the output that we have brought up. Is it really what's happening on the ground? Is it really would be beneficial to the government of India, any public health official, to prevent the outbreak of such diseases? So what we did, there is a official body known as National Vector-Borne Control Disease Body in India. This is an official body. What this body does, it publishes the number of cases, the number of deaths by different diseases, especially the epidemics or the vector-borne diseases per month, per city, per state. So that gives you a data. So what we tried, we correlated the data that we have got through our analysis with the actual number of cases on the ground. Okay, so I will just take the example of Delhi here. So this is a trend line for our analysis, but this aligns with what the output was from the government of India. If you go through that website, you will come to know that from April 2020 till September 2022 in New Delhi, there were around 40739 dengue cases with 8 deaths. Okay, and if you go a little bit deep into the data, the power lies in the in the detailing. Out of those 4,700 and odd cases, around 70% of cases happened in July, August, and September, as per the government of India. And when we try to analyze or superimposed our data points, this is our trend line is our data point. Okay, you will also see a spike in conversations in these 3 months. Okay, and these data points were captured earlier. Okay, we were capturing these since April. So that's why you see we have these data points for April. There is a steep curve, and then it's the conversations or the data points kinds of rises. So it kinds of corroborates what is actually happening on the ground. You see the spike here in the number of conversations. You see the spike in the number of cases that is registered by the government of India. Okay, so that's how we want to move forward and take this platform forward. And similarly, we had correlation across different states. If you can go to the slide. Yeah, just go. Okay, anyways, we also tried to analyze different states. I gave an example of Delhi, but we found similar correlation in UP, which is one of the largest states. It is the largest state in India. Okay, we saw there were 3 epicenters: Lucknow, Agra, and Ghaziabad, and this is all official data. Okay, the one that I mentioned is all official data. You will see they were around Lucknow, which is the capital city of Uttar Pradesh. There were around 20-30 cases, and we found a similar correlation with our analysis as well. Okay, and if you go down deep, we also analyzed Karnataka state. And we found in 3 regions, Bangalore, Udupi, and Mysuru, a similar spike in the cases and the data points that we have captured. Okay, so that's what we aim to do with SARTHI. We actually want to, we want to use this platform to take the preventive healthcare forward. We want to use it as a tool to send alerts or a brief synopsis of anomalies between the healthcare outbreaks to the public health officials, to government of India, and so on and so forth. But as I said, this is very embryonic. The flip side, he'll always talk, when they're on the stage, they always talk about the positive points. I think I'm the first person who will talk about the negative points. Negative points, it does not have data from the hospitals. It does not have the data from laboratories. It does not have the data from the epidemiological survey that Government of India conducts. Imagine if all that data is ingested into this, the output will be magnificent. It will be more accurate. It will be more robust. And the citizens of India would definitely benefit out of it. So that's the aim. Hopefully, we can take it forward. Ajit sir, you want to cover the last slide?
Yeah, so I just want to close this with the roadmap that we have, because though Dr. Sumit mentioned the gaps or the challenges that we have, I also said in the beginning that as a IET neutral platform where all of us, including competition, are coming together to solve this problem, what we are also trying to do is to also validate this data on the ground, right? With CHRI, PATH, etc. We are validating this with on ground with this data, and that's going on right now. What we also want to do is also try to see if there's a correlation amongst the diseases, right? Because we know from our disease things that dengue and malaria are reversed, right? One is a freshwater one is a swampy water one. So that kind of correlations also we want to do so that we could factor in the things. We want to also be able to generate a predictive model around it, right? So using the actual data, using the social media data, and the collaborations that we have in ground, including the weather conditions, humidity, rainfall, because these are vector-borne diseases, you know it's getting impacted by this. So if you are able to create a model and really predict, that would really have the power of it, which we want to take also to the government of India and beyond, right? Because if you're able to say that, okay, in December, in Bangalore, in Jayanagar, this is the outbreak that's going to happen in December 2022, that will be the real power of it. And that's what we want to do towards our overall game of having, overall goal of having health for all and reduce the burden on the healthcare ecosystem. Yeah, so that's what I will end this session with.
Team, this is amazing. You could not have made us proud, more proud than this year. This project has been very, very close to us, and me being the healthcare track chair, I really felt sort of, this is the way that we really want to take if we have to sort of evangelize affordable healthcare and help people manage their lives a lot better in addition to sophisticated technology that we discussed. So thank you once again, team. And with this, I also request Chakshu, Reshma, Mahesh, and Anjali to come on stage, please, along with Shika and Dr. Vikram. You guys have made this possible.
It was exciting to see the SARTHI live demo. Did you notice, we interfaced the projections with the tablet real time. Technology at play.
Chakshu, Reshma, and Mahesh are from Capgemini, and they have been working on a dashboard. Anjali is from Siemens, and she worked on data extraction and ETL and all of those. So thank you once again, team, for this stupendous work. Now, this is only the beginning. I can promise you, we really want to see it scaled at a national level.
So Ravi, I just wanted to add one more point. In the expo yesterday, right, we had a lot of good inputs that came from also the previous health secretary, Dr. Siva Selvam, right? So he was also saying that you could also use this for mental health cases because that's also increasing because of the pandemic and things like that. So that's a very good insight that we got, and we also want to extend this because this is a platform, right? So it doesn't matter which disease condition you try to model. So that's what our next goal also is going to be. I just wanted to make that point, Ravi.
Sumit?
I want to take this opportunity while everybody, all of you are on stage, to really thank all of you for the tremendous work that you have done. Also want to kind of pat ourselves, the IET, on the back a bit, because the platform that the IET provides, and this is the true power of the platform that IET provides, to get so many excited, passionate people to come together and create a solution which makes a difference, creates an impact. And thank you for taking that platform and creating this. Thank you so, so much. Wouldn't have been possible without the work that you put in. And sir, under your able guidance.
Can you call Dr. Julian?
Can I request Sir Julian to come on stage and felicitate these extraordinary people who have been doing such amazing work?